Assalamu alaikum. Welcome all to my Easy Human Anatomy channel. In this video, I include the Anatomical Terminology course 2. In previous course, I include anatomical position and anatomical plane. In this video, I include the name of the joint and the name of the movement. At first, the name of the joint. The logic behind the name of the joint according to the locations: shoulder joint, wrist joint. According to the name of the articular surfaces of the bones: temporomandibular joint. Here, the name of the two bones are used in this joint terminology of this joint. According to the locations and name of the articular surfaces of the bones. Example: superior radio-ulnar joint. Superior means location and radio-ulnar is the articular surface of radius and ulnar used in joint formation. According to the name of the bony part and cartilaginous part. Here is the example: costochondral joint. Costo means rib, bones, and chondral means cartilage. So, costochondral joint, the joint between bones and cartilage. Symphysis. Symphysis, this terminology used in some joint for naming some joint. For example, pubic symphysis, symphysis menti. So, symphysis means the union, meeting point or commissure of any two structure. This is the example of pubic symphysis. This is pubic bone. This is another pubic bone. This is articular surface of pubic bone which is covered by thin plate of hyaline cartilage. This is another articular surface of the pubic bone which is covered by thin plate of hyaline cartilage. And these two hyaline cartilage is separated by another cartilage, fibrocartilage. This is the structure of the pubic symphysis. The terminology of the movement. Some terminology used to describe the movement of the joint. For example, flexion, extension, adduction, abduction, medial rotation, lateral rotation, circumductions. So, at first, the definitions of this terminology. First, extension. Extension means straightening of a joint or increasing the angle between two bones. Flexions means bending of a joint and decreasing the angle between two bones. But the meaning of the extension and flexions are different in different joint. This is shoulder joint. This forward movement is known as flexion. This backward movement known as the extension. It is not matched with the definitions of flexions and extension. This is the movement of the elbow joint. The angle when reduced, upward movement of the forearm. This is known as a flexion. The straightening of the forearm is known as the extension. This is wrist joint. This is extension and this is flexion. This movement is not matched with the definition of flexion and extension. In neck region, this is flexion and this is extension. For trunk, this is flexion and this straight position known as the extension. And this is the lateral flexion of the trunk. Hip joint, the forward movement of the femur is known as the flexion. In hip joint, the backward movement of the femur known as the extension. This is knee joint. The leg is directed upward, move upward. This is known as the flexion. When leg and thigh in a straight position, standing position, this is known as the extension. These are the movement of the ankle joint. There is a two flexion movement when the foot is directed upward, this is dorsiflexion. When it's foot directed downwards, this is plantarflexion. The movement of the thumb. This is the flexions of the thumb. This is extension of the thumb. Now, abduction and adduction. Abduction means the moving away from the sagittal plane. Adduction means moving toward the sagittal plane. So this is the upper limb. When upper limb add with the tongue, this movement is called adduction. When upper limb is away from the trunk, this is known as the abduction. And this is the sagittal plane. The movement toward the sagittal plane known as the adduction. The movement away from the sagittal plane is known as the abduction. This is the movement of the wrist joint. This is radial deviation. This is ulnar deviation. Radial deviations means the hand is moved in the right side, and when hand is moved in the medial side. This movement is lateral side and movement of medial side. This is known as the abduction and this is adduction. This is the movement of the thumb. When the thumb is attached with this other finger, this is known as the adduction. When thumb is away from the other finger, it is known as the abduction. The movement of the fingers. The axis of the movement is the middle finger. When all finger is moved toward the middle finger, this is adduction. When all finger is away from the middle finger, this is known as the abduction. For hip joint, when femur is away from the sagittal plane, this is known as the abduction. When femur is toward the sagittal plane, this is known as the adduction. Medial and lateral rotations. Medial rotatory movement around an axis of a bone. Lateral rotatory movement around an axis of bone. Medial rotation. The medial rotation of shoulder joint. These are the axis of the joint. Around this axis, if the humerus is rotated medially, this is known as the medial rotation of the shoulder joint. The opposite movement when humerus is rotated laterally around this axis, this is known as the lateral rotation of the shoulder joint. Like this, in hip joint, the femur is rotated laterally around this axis and femur is rotated medially around this axis. So this is lateral rotation and this is medial rotation of the hip joint. And some special type of movement, for example, the subtalar joint, this movement is inversion and this movement known as the eversion. Another special type of movement, protractions moving forward along a surface, retraction moving backward along a surface. This is neutral position. From these neutral positions, when something is moved forward, this is known as the protraction. From this neutral position, when something is moved backward, this is known as the retraction. So here's this movement. When mandible is forward, this is protraction. When mandible is backward, go backward, this is known as the retraction. Depression and elevation. This is depression of the mandible. This is elevation of the mandible. This is depression. This is elevation. Circumduction. Circumduction means the combined movement of the flexion, extension, abduction, adduction, medial and lateral rotations circumscribe a cone. By this using forearm, if we make a circular area. To make this circular area, there is all necessary movement is required. So this is known as the circumduction. Supination, pronation. Pronation is placing palm of the hand backward. This movement of the forearm known as the pronation. When the placing palm of the hand is forward, anatomical positions, this is known as the supination. Oppositions. Opposition, bringing tip of the fingers and thumb together as in picking something up. This is the counting movement. It is the combination of the flexion and medial rotation of the thumb. Opposition is like this. This is the counting movement. This is the combination of medial rotations of the thumb and flexions of the thumb. Side to side movements. These are the side to side movement. It is seen in the temporomandibular joint. So this is all about this video. If you like this video, please press the like button and please subscribe my channel. Thank you.